from his research, he concluded that there is either a positive or negative correlation between the two dependent on the patient's mood and mental outlook. If this correlation is true, it is then our purpose to promote mindfulness so that a person, whether be patient, recovery, or family member, may be able to be made aware of their thoughts and feelings on cancer in a non-judgmental and accepting way. We promote this in hopes to stimulate positive thinking and hopes to generate a positive correlation between the mental and physical aspects of health. And I will now pass it on to Matt.
So, like as he said, there always has been the idea of this, if you have positive attitudes, you'll feel better, but we don't necessarily want to hold these patients to always be happy and positive, because cancer is a really difficult and hard thing to deal with. So we want to create a space and a project where these patients or survivors or family members are able to come in and tell whatever the story they feel. If it's a really hard day and they want to come in and, it's an art project, so if they want to draw how they feel, we want to create a space that's non-judgmental and allows them to do that. We want them to be able to tell their own story and just feel how they feel and not feel pushed to feel positive. But we always want to encourage to be positive and to always find the silver lining in their situation. So we'll turn to Mary Jane.
So I did a lot of research on Remission Society, and in the book, The Sociology of Health and Science, Arthur W. Frank defines Remission Society as a group of people efficiently well, but could never be considered cured. And Remission Society, though it can be nice to have some of these people that you can fall back on to kind of help because they've gone through the same thing, it also keeps these people in a constant state of being a patient. They are never completely cured. And what would happen if the cancer comes back? Are they then kicked out of the Remission Society? We also did some research about the term survivor as far as cancer goes, and found that a lot of patients don't like the term survivor because because they survived their cancer doesn't mean that they fought any harder than any of the other patients, anyone else who died. They didn't fight any harder. They were just lucky. So it's just good to make sure that we don't give cancer patients these labels that could then make it so that they can never recover fully from their cancer mentally. And I will now turn it over to Esther.
My research was concerning the definition of well-being on the mind and body. Essentially, a lot of my research came from an article by Barr and also from the Huntsman Cancer Institute, and I was researching into the different levels of well-being and how we may define them at a different individual level versus the physical and the psychological, and also how also from by putting by putting label. I was also looking into the concept of mindfulness, which the definition is being conscious and aware of something, also the physical and the mind. And I was researching into how this could apply to the negative correlation of having a constantly positive outlook on viewing cancer, and how it would actually disrupt the utter emotion, block the utter emotional spectrum. And I will
So our group has done a lot of research into the empirical effects of mindfulness as well. The Journal of Personality and Social Psychology has done research that found that mindfulness and mindfulness training among patients not only increases the patient's clarity and attention, but it also reduces physical symptoms in the patient, such as pain, as well as the need for constant medical visits. The Australian-New Zealand Journal of Psychiatry found that it improved both antibody production in patients as well as left hemisphere activation in the brain. And the Journal of Behavioral Medicine supported both of these findings. for all of this research, the techniques used were often either meditation, or meditation, or some form of repetitive art, such as painting or drawing. And with that, I'd like to welcome up the arts group to talk more on that subject. Thank you.